So let's talk about the treatment of community acquired pneumonia. Okay, so before you start the treatment of community acquired pneumonia, first of all calculate the PSI. Okay, PSI or a curve 65 score to assess the need for hospitalization. Okay, so if PSI is less than 70 or equal to 70, or curve 65 is less than 1, okay, then we will go for outpatient treatment. Okay, and if the PSI is more than 90, COP 65 is more than 2 or equal to 2, or even CRB 65 is more than or equal to 1, then we will opt for inpatient treatment. Okay, so before I start about talking about inpatient treatment, let us talk about the outpatient treatment. Okay, now in the outpatient treatment there are two things that we can do. Okay, either we can do monotherapy or we can go for combination therapy, and that will be decided whether there is any comorbidities or risk factor for the resistant pathogen or not. Let us say the patient has any of these three things, that is chronic heart, lungs or renal or hepatic disease. Okay, or any immunosuppressed state, that is diabetes mellitus, malignancy, treatment with IV antibiotics in past 90 days, either of them, then we will opt for the combination therapy. And remember, whenever you are giving combination therapy, you have to give uh, either a combination of one beta lactam or one macrolide, or we can choose monotherapy with respiratory fluoroquinolones, which is levofloxacin, moxifloxacin, or gemifloxacin. So however, remember, to get the mox, okay, to get the mox you have to live like gems. Okay, you have to live like gems to get the mox. Okay, so levofloxacin, gemifloxacin, and moxifloxacin. Suppose you are choosing monotherapy, then you will choose amoxicillin, doxycycline, or macrolide, either of them per oral. But macrolide only in the areas with low pneumococcal macrolide resistance, because usually there are areas where there is macrolide resistance. So only choose macrolide where there is pneumococcal macrolide resistance is very low. Okay. Now talking about the another limb of the treatment flowchart, if we have curve 65 is more than or equal to 2, or PSI is more than 90, then we will do inpatient treatment. Okay. Now, even in inpatient treatment, first of all you have to ask whether there is pseudomonas involvement or not, whether there is a chance of pseudomonas involvement or not. Now, if there is a pseudomonas involvement risk, for example, previous isolation of pseudomonas in the sputum, severe community acquired pneumonia with recent hospitalization, or IV antibiotics in the past 90 days, if yes, then the treatment will differ, because we will have to give anti-pseudomonal therapy, for example, tazopip, cefepime, ceftazidime, meropenem, imipenem with celastine. Okay. Now let us say, even in the inpatient, either we are choosing ICU treatment or non-ICU treatment. In ICU treatment, what are the factors that will tell that we will have to choose the ICU treatment is whether the patient is having hypotension requiring vasopressor, or there is respiratory failure requiring mechanical ventilation. If there is any suspicion of these two, then we will choose ICU treatment. Let us say there is no such things, then uh, if the patient meets IDSA or ATS criteria for severe pneumonia, no, and less than 3 minor criteria, then we will choose non-ICU treatment. Okay, so for ICU or non-ICU treatment, one thing is common, that we have to give combination therapy, one beta lactam, okay, IV with uh, beta lactam. What we gonna choose depends on whether it is ICU or non-ICU treatment. And luckily there is only two drugs that you have to remember extra for the ICU treatment, that is levofloxacin or moxifloxacin. Otherwise, in combination therapy for non-ICU treatment, you can add with beta lactam azithromycin, clarithromycin, or doxycycline. One thing that you need to keep in your mind is that in azithromycin you will give IV, later you will switch to peroral, but with clarithromycin and doxycycline you can give peroral. Okay. Now, after doing all these even if you have a suspicion for MRSA involvement, okay, then you will add anti-MRSA therapy, that is vancomycin or linezolid per oral, okay, vancomycin IV or linezolid per oral. But what are the things that will make you think uh, suspect about the MRSA involvement are previous isolation of MRSA in the sputum, severe community-acquired pneumonia with recent hospitalization, IV antibiotics in the past 90 days. Okay, so this was all that I wanted to talk about the treatment of community-acquired pneumonia. In the next video, I will also talk about the algorithm of um, community-acquired pneumonia in UWorld. But for now, I will end this video. Thank you. If you like the video, please like the video and share it with your friends. Thank you very much.